Nigeria is the 37th largest economy in the world. The nation has vast human, agricultural, and natural resources and has earned over $700 billion from petroleum alone in 3 decades. Our annual growth rate averages over 7% in official data during the last decade, placing Nigeria among the fastest growing economies in the world. Yet, despite these figures, 112.5 million Nigerians are regarded as poor, a staggering 70% of Nigeria's population. Poverty reduction and job creation have not kept pace with population growth, implying social distress for an increasing number of Nigerians. Life expectancy stands at 51 years. The United Nations Human Development Index, which is a composite statistic of life expectancy, education, and income indices, places Nigeria as one of the 33 poorest countries in the world. So why is Nigeria's wealth not trickling to the 70% of its people who are considered poor? There are several issues. One is corruption. The other is poor infrastructure, especially power. Hostile environment for business and commerce. Another is low investment in education, especially in the sciences, mathematics, and technology. There's of course poor and incompetent governance. Then there is a misprioritization of state resources. At the moment, the federal government spends 70% of its income on recurrent expenditure and 30% only on capital. Then of course there is little direct spending on reducing inequality. Let us examine the effect of poverty on a typical Nigerian citizen Odafe. What does Odafe and his family need to live even fairly decently? The basic requirements, of course, are income, housing, and health services. Odafe earns, say, about 20,000 naira per month. This is a measure of Nigeria's GDP per capita for 2012, which stands at about $1,555. But Odafe is fortunate because official statistics indicate that at least another 20.3 million other Nigerians between the ages of 15 and 35 are unemployed. In fact, a senior official in Nigeria's ruling party puts the unemployment rate at 80%. The Federal Ministry of Youth Development states that as of 2008, Nigeria generated about 4.5 million new entrants into the labor market annually. The figure it stated was made up of 1 million people out of the school system, 2.2 million primary school leavers not proceeding to secondary school, and 1 million secondary school leavers not proceeding to the tertiary level, and another 300,000 university graduates or graduates of other higher institutions finding no placement anywhere for productive engagement. If Odafe has malaria, he has to go to one of the 22 facilities available to every 100,000 Nigerians. To consult Dr. Hassan, one doctor who must attend to 16,427 other Nigerians because of our dismal doctor-to-patient ratio. Odafe has no form of health insurance, as only 1.5% of our population have any coverage, so he must pay for care and medicine from his 20,000 naira salary. Again, he's lucky to meet Dr. Hassan because about 75% of Nigerians have no access to primary health care. What of his pregnant wife, Joy? The risk of Joy dying from childbirth is 1 in 18, compared to 1 in 61 for all developing countries, and 1 in 29,800 for Sweden. One Nigerian woman dies in childbirth every 10 minutes. On the whole, 55,000 women die annually from childbirth in Nigeria. That is 150 women every day. Someone has described the situation as comparable to a Boeing 737 jet filled with pregnant women crashing fatally every single day. Would their unborn child fare any better? Well, 861,000 children under the age of 5 died in Nigeria in 2010. 197 out of every 1,000 Nigerian babies die before they are 5 years old. So your guess is as good as mine as to what will happen to the baby that Odafe and his wife give birth to. What about Odafe's housing conditions? Just like 59.2% of other Nigerian households, Odafe, his wife, and 3 children live in a single room. They are fortunate, as an estimated 24.4 million Nigerians will be homeless by 2015, and that's official. Odafe and his family drink water from rainfall, wells, and streams, much like 40.6% of Nigerian households do. So only 6.9% of households in Nigeria have access to treated pipe-borne water, even down to basic sanitation, such as toilet facilities. Most still use pit latrines, no modern water flushing facility. This is a luxury only 11.6% of Nigerian households can afford. So, what happens when Odafe Jr. goes to school? His classroom in the public school has no blackboard, and he sits on the floor. Although he's 12 years old, he cannot read or write. Indeed, his teacher can barely read an affidavit which he is supposed to have deposed to. On top of this, Odafe Jr. is always hungry at school and can barely focus on his classes. His younger sister, Beauty, is not that lucky, as she has to hawk groundnuts to support the family's income. She's out of school just like the more than 8.2 million Nigerian children of primary school age. Then there is Zainab, who lives in Borno, and she cannot read a sentence in any language, just as 2/3 of girls in northern Nigeria between the ages of 15 and 19. 70.8% of young women aged 20 to 29 in the Northwest are unable to read or write. In the North, net enrollment for girls in primary schools is 34%, and secondary school is 10%. What even more tragic is the fact that Odafe Jr., Beauty, Zainab, and many other Nigerian children would go to bed hungry almost every night. So we have a situation where the vast majority of the population of our country is poor, deprived, and suffering. Several, especially children, going to bed hungry at night. Others dying because of extremely poor medical facilities. Without a doubt, this is a national disaster. Besides the medium and long-term measures to address economic growth and the infrastructure deficit, some immediate interventions to address poverty are necessary. First, a general framework. 1. Government must accept that the poor man, the citizen or Dafes of Nigeria, must be the sole focus of economic and social policy. Economic models that do not focus on actual human beings and their problems are unhelpful. Any serious government must rise to the challenge of getting people out of poverty en masse. China lifted more than 600 million people out of poverty between 1981 and 2004. In that same time frame, Nigeria dragged almost 100 million people into poverty. In China, the poverty rate dropped from 85% in 1981 to 16% in 2005. Poverty being defined as the number of people living on less than $1.25 a day. In Nigeria, poverty increased from 28% in 1980 to 71.5% in 2012. India has introduced initiatives that are set to reduce poverty from 51% as of 1990 to 22% in 2015. The second point to note in this general framework is that the Nigerian political elite must be prepared to make some serious sacrifices to get the majority of Nigerians out of poverty. The current expenditure pattern which we have is simply suicidal. The federal government is illustrative of this problem. Over 70% of Nigeria's budget goes to recurrent expenditure, paying for salaries and consumption of probably about 500,000 public servants. The example of the National Assembly is apt. The National Assembly spent $232 billion in 2011 and $150 billion in 2012, while Nigeria's capital expenditure was 1.12 trillion and 1.32 trillion for 2011 and 2012 respectively. So in 2012, 469 legislators spent 11.4% of what it might have cost Nigeria to build roads, bridges, hospitals, schools, and railways. What can be done to change these appalling numbers? The focus of government must be on the people, not on abstract theories or policies. How does the man on the street manage? How can Odafe, Zainab, Kola, or Chioma feel the impact of government on their poverty-ridden lives? The political class must be willing to make serious sacrifices. The amount taken from the public purse to run our democratic contraption is just too enormous. What happens when we spend that kind of money on just maintaining our political structure is that we impoverish the people that elected officials in the first place. A serious government must directly intervene to avert the total collapse of our national life on account of poverty. The social consequences of poverty are already evident. It is the business of responsible government today to reorder its spending priorities to provide for its most vulnerable people. The federal government in particular must engage in creative social programs that get huge numbers out of poverty. This must be in the form of income redistribution that directly transfers cash or kind to alleviate immediate poverty. One of the most effective ways of government directly intervening to reduce poverty is food intervention. I'll take an example of Osun State. Osun State has a feeding program for primary school pupils. So every day, the state government provides lunch to 254,000 pupils. It costs the state 12.95 million naira per day and about 2.3 billion every school year. So averagely, it spends about 52 naira per student or per pupil. Now check out the multiplier effect of that. because the state government feeds that number of children, there is a total number of over 3,000 food vendors and caterers and cooks who are currently employed to serve these midday meals to the pupils of Osun State, of primary schools in Osun State. All the food items being utilized for feeding the pupils are sourced locally from farmers and others on the supply chain. Imagine the effect of these on these people and their families. Of course, poor parents have a reduced burden of feeding their children. What is more, the program itself has shown that malnutrition can be reversed if government chooses to intervene in feeding children in primary schools. Besides, academic performance is enhanced and school enrollment itself is enhanced. Since the program started, Osun State now has the highest pupil enrollment in Nigeria. The Osun example is one that has been successful in other countries as well. India, for instance, has a national program, and at the moment it feeds about 120 million of its pupils in primary schools. Ghana also has quite a successful program, feeding several thousands of its pupils in primary schools. Now, what could happen here? And let's just look at the potential for maximum impact. If the federal government, for instance, were to match this effort naira for naira and apply it nationally, we could simply have a situation where, I'd say, a sum of 82.8 billion, we could actually feed more than 9 million school children every year. If the federal government, for instance, spends just 82.8 billion on feeding children, just matching what the states may choose to do, we could actually feed more than 9 million school children every year. So you can see for yourself why we cannot simply spend 150 billion on some politicians. Now let's take another example of direct intervention which is possible. This is health intervention. The National Health Insurance Scheme, NHIS, already provides for a reduced premium payment of 12,000 naira per annum for coverage. Now, that scheme at the moment accounts for 1.5% of Nigerians. Imagine a situation where the federal government intervened and funded the health insurance of the most vulnerable Nigerians. For example, pregnant women and children between the ages of 0 and 5 years. There's a multiplier effect. As the healthcare system expands, it means more doctors, pharmacists, nurses, and other healthcare providers will be employed. It means a boost for our local pharmaceutical industry. Indeed, local governments may even benefit because they may also expand their primary healthcare facilities to make room for the expanding number of persons who have access to the medical care system of the nation. In most emerging countries, the percentage of people with healthcare insurance coverage may be quite low, with the exception of China. In 2010, China successfully brought close to 90% of its population from less than 25% in 2004 under the purview of 3 state-run health insurance schemes. This has helped China's rural population have better access to healthcare. Brazil also has 25% of its population covered by private insurance. Public and private health insurance covers about 25% of the population in India as well. I think it's entirely possible for us to run a creative healthcare insurance system. Today, several innovative strategies, especially the use of microfinance institutions. Again, direct intervention is possible. Osun State, for example, about 2 years ago, employed at one go 20,000 graduates. Now, this was an emergency intervention that the state government decided to undertake. While in the employment of the state, these 20,000 graduates were also being trained. Aside from being occupied in services to the state, some were trained in entrepreneurial skills, some were trained in IT. In fact, a large number of them were given different forms of IT training. Some were even trained as farmers. While all of this was going on, of course, they were being paid a stipend. Now, take the situation of 300,000 tertiary graduates who are currently unemployed. It's entirely possible for the federal government, as a palliative measure, to decide to engage these graduates and pay them anywhere between 20 and 25,000 naira as a stipend per month while training them in the various skills that I had mentioned earlier, and trying to prepare them for a more useful life. And of course, in that period, taking them out of poverty. The cost of that, assuming for instance that they were paid a monthly stipend of 20,000 naira, just a stipend, not a salary, the cost would probably be about 6 billion monthly, and something like 72 billion annually. Of course, if they are paid more than that, we can simply do the math. Now, it's important to understand that this is a palliative. It's just it is just a short-term intervention, but it assures these young men and women of some living expenses on the road to learning the vital skills that would sustain them in the future.